Good evening. This is Tracy Trypuc from Your Health Matters. Tonight, I'm reporting live from Adelphi University from their Sports Concussion Symposium at the Alumni House. I would like to thank Dr. Michael Kennedy for being with me here this evening. He is the Chief Medical Officer at Expert Medical Care in Huntington and an attending physician in the emergency department at St. Francis Hospital. Thank you for being with me, Dr. Kennedy. Would you like to share with our audience about some of the things that we discussed this evening?
Yes, I was invited to this evening to talk about, give an introduction regarding sports injuries and sports head injuries and trauma. I had the opportunity to talk with a great audience who came out to get more information, give more awareness to the subject matter. I was able to discuss concussions, the strategies about diagnosing, on-the-field management, go ahead and talk with the personnel in the audience about the return to play criteria and how important it is that the community, medical professionals, athletic trainers come together in the care and the prevention of injuries.
What do we do when we have some new technologies available? And one of those were some blood tests. Would you briefly like to discuss some of the things we were talking about where do we go from here if we have some new technologies for the players?
Traditionally, physicians were challenged by assessing athletes just clinically. And there were certain criteria regarding imaging, CAT scan imaging, MRI imaging, EEG imaging. What's going on now is there are a lot of industries who are very involved with looking at what they call brain peptide biomarkers to give it another arm or another way for us to assess how athletes are injured in terms of giving us levels of injury and maybe giving us an opportunity to follow those levels serially to see if a particular athlete can return or not. I think after we get better at diagnosing concussions and we can serially watch an athlete, I think we're going to ask ourselves even more questions. We're going to say, what can we do in terms of the treatment process of returning an athlete back to their sport safer and quicker? For instance, if there is a particular brain peptide level that we're going to follow, can there be an antidote that we can give an athlete to help in the repair process of the brain? Can we administer hyperbaric oxygen? Will that benefit an athlete who has sustained a concussion? I mean, these are the kinds of studies that we're looking to, I'm looking forward to see that are done statistically in a clinically way with the researchers to see if we can do something in the treatment process as well.
The wonderful symposium you had, wonderful panel, and I look forward to speaking with everyone. So thank you again for speaking with me.
Thank you very much for having me. Appreciate it.
Thanks, Dr. Kennedy. And now I have with me Dr. Kevin Curley. He is the attending physician for Winthrop University Hospital, and he also attended tonight's panel discussion. Welcome, Dr. Curley.
Thank you. Thank you.
You talked about identifying signs and symptoms, and you also discussed complications of concussions. And you talked about the Listet laws and Zurich, some Zurich. Could you please expound on that for our viewers?
Sure. The Listet laws are basically laws that have been put in all 50 states and the District of Columbia that require any student in an interscholastic sport who is suspected of having a concussion must be removed from the game and play and may not return until they're evaluated and cleared by a certified medical provider with expertise in concussion. And the first state, Washington State, passed this back in about 2009, and it quickly spread to all 50 states and District of Columbia, which is basically unheard of. And it's made a big, it saved lives already. There have been cases where people have been held out that may not have been held out, and coaches and other trainers are much more aware about the risks of second impact syndrome, for example, which is one of the reasons we hold people out from concussion. If people get hit on the head a second time before they fully recover from a first concussion, the autoregulation of the brain is affected, and they can cause herniation in the brain, which usually equals death. So, in a way, this law can be life-saving.
And you also, there was a theme this evening, which was when in doubt, sit them out. Could you please speak about that?
Yes, a lot of times in youth sports, a lot of times it's parents and non-medical people who are there, coaches, parents, and they may not have the medical background, and they may be a little intimidated by what to do. So we usually use the same saying, when in doubt, sit them out. If you're not sure, it's better safe than sorry. Remove them from the game. Don't let them harm themselves, potentially. It's better to hold someone out, maybe unnecessarily, than to put someone in who really should have been held out and then have something really dramatic and dire happen. So it's more of a safety thing, and we use that in professional and college sports also. If we're not sure, we're a little uneasy, we always, when in doubt, sit them out.
Okay. You showed us a few, stepwise throughout return to sport and beware of exertion, and you talked about parents and coaches. Would you please explain to our viewers?
Sure.
About that?
Yeah, those are the return to play guidelines, and the ones that we follow here, we're at Adelphi, are the Zurich guidelines, and it's basically a stepwise return to play. It's a 6-day program. You first wait for the athlete to be totally asymptomatic without headache, dizziness, any symptoms of concussion for 24 hours. Once that happens, you let them just get their heart rate up the next day. So all they're doing is riding on an exercise bike, maybe going on a treadmill, just getting their heart rate up. They're not doing anything more than that. If that's successful, then you can move to the next step, which may be running, or if they're a hockey player, let them skate around the ice, no contact, no playing with the stick, no passing, just a little sports-related activity. Then they go to the next step, which may be a little more skill-based drills. For example, hockey players passing the puck. Basketball players may be dribbling and shooting, bringing their vision into play. If that's fine, then the next day is day 5. They can go a full contact practice. And if day 5 is successful, day 6, they're cleared to go back to full sport. So you can see, even if someone's asymptomatic for 24 hours, it's at least 6 days more before they're able to return fully to play. So usually it's a week, 10 days that somebody is really out before they can return to full play from a concussion.
It's better to be safe.
Better than safe than sorry. And the point here with the guidelines is that once you're asymptomatic for 24 hours, that's not enough. You need to progress through all 6 days and all 6 steps.
And you said I can go ahead and put the website up later, but through the cdc.gov, and there's a pocket CRT as well?
Yes.
Okay.
Yes, cdc.gov has a concussion. If you search concussion on the website, it'll give you a full free online training program for coaches and lay people. And also, you can also Google the Zurich conference guidelines, and you'll find a lot more information there, and even a free pocket card that can be available.
Wonderful. Do you have any final thoughts?
Just when in doubt, sit them out.
Thank you so much. I
Thank you.
appreciate you being here.
I'm a big proponent of zero tolerance. I think the head and the neck should be off limits in all sports. We'll protect the knee, we'll protect other areas, but the most important part of any athlete is their neck and their brain. And that has to be protected no matter what in all of sports.
With me now, I have Mr. Pat Lafontaine, who needs no introduction, but he has been in the All-Star in the National Hockey League, and he also has a foundation for Companions in Courage Foundation. And I thank you for being here this evening.
Great to be here. Enjoyed it.
Okay. And I would like to just discuss with you a few things. You did retire after a series of head traumas and concussions, and you were discussing that a little bit. If you'd like to just speak with our viewers a little bit about that.
Yeah, no, I was very fortunate and blessed to play 15 years in the National Hockey League and all throughout New York State, the Islanders and the Sabres and the Rangers. And at a certain point in 1997, 98, I took my last concussion, and at that point, I went through post-concussion syndrome for the second time for about 6 months. And very fortunate to get some really good advice from some very great doctors. Dr. James Kelly, who I've become very good friends with and work with and help out any way I can, was giving me the green light to go back at one point, and also was a doctor who said to me, it's time to hang up your skates. What we know about concussions at the time, you've crossed the line, and really the next hit could be more concerning. And so once you get to that point, you really need the advice of a doctor who has the history and has the knowledge, because as an athlete it's very hard to say when. And I was relieved but yet saddened at the same time, but he said you'll look back at it and be grateful as time went on, and I have to tell you, it was the best piece of advice, because knowing what I know now, I'm very fortunate. I have 3 wonderful, healthy kids, a great, beautiful wife, and I have all the excitement and passion that I did when I played. And so I think the physicians and the knowledge and the changes that and the awareness that the National Hockey League has brought forth over the years is what's been important. I think awareness is knowledge, and it's allowed me to make the right decisions at the right time, and try to give back and help. I think you learn through experience, and hopefully the experience teaches you, and you can help pass some of those experiences on for other players or athletes that are going through concussive issues. And I think, like I said earlier, I think awareness and prevention are so important.
And so since you've retired and you've gone through that period, you do see that there have been some changes, very positive changes.
Yeah, in fact, one of my last concussions in 1996 actually was the impetus to spurring on the National Hockey League to do baseline testing for every team. So I feel as though, even though I had to go through a difficult time with post-concussion syndrome, the benefit, or the positive, the silver lining, was that the National Hockey League took that way back in 1997 and then chose to baseline every single NHL player. So I think we've come a long way, and we continue to work. I'm actually involved with the National Hockey League now in the concussion subcommittee to try to also lend whatever experience and try to help to continue to bring awareness, continue to grow, and continue to help making our game safer. And I think that's one thing that's been really, really in a positive nature, is that I think sports and in general has brought this situation of concussion to the forefront, and trying to find and work with whether it be changes or protocols to continually make the concussion situation better for those sports athletes going forward.
Well, I must say that I appreciate the fact that you're still involved in this, and that you continue to bring awareness and share the information that you have, and share your story with those that are involved in trying to help, bring awareness throughout the country to all sports.
Well, I think I've always said this. I think every experience prepares you for what you're going to do next, and I think if you learn and apply, there's always been somebody who's walked before us. So there's a lot of learning. I can only share with what I've gone through to help. I think bring those experiences to, I think, athletes of different sports. I can tell you that probably the thing I get the most from speaking to younger athletes in different sports is that they all say the same thing. Is that you understand. You know exactly what I'm talking about. I have a saying in life: to know and not to do is never to know at all. I didn't choose this. In this case, it kind of chose me. But I think when you make that connection with an athlete who is going through post-concussion syndrome or going through a tough time, somebody who really understands and knows what they're going through, it does help to feel that you're not alone, and then you can share some more experiences. So from that aspect, there's a silver lining to try to give back. And, a lot of athletes have done the same thing for me during my playing days.
Well, I'm sure that they appreciate it, and those that you continue to help today appreciate what you do for them. So, and I thank you for being here tonight. I know that I've learned a lot, and I thank you for being here right now. So
Oh, my pleasure. Thank you. Thanks for
Okay.
having me.
Thank you very much.
Thank you.
Okay. And now I'm with John Sperzel. He is the CEO and president of ChemBio. Welcome, John.
Hi, Tracy. Thank you for having me.
So, John, you are the company that is working on this blood test, which is similar to a troponin level. And for my guests, that is a blood level that they take in the emergency room to see if you have a heart attack. So the test that you are now working on is a blood test to possibly find out whether or not you have had a concussion. Would you like to explain that further to my guests?
You're exactly right. So in January of this year, we partnered with Perseus Science Group and married our patented technology, which is a derivative of lateral flow technology. It's patented at ChemBio in 2007. We marry that with a patented biomarker technology that Perseus Science Group has. And our goal is to put together a point-of-care rapid test. We're talking about a 15-minute test from a finger stick of blood that could tell if someone has a sports-related concussion.
May I interrupt? The 15 minutes is very important, I must say, because troponin levels take longer to come back usually. So I just want to say that 15 minutes is very impressive. So, okay, you can go ahead now.
So we're excited about that. We're a company that has deep history in point-of-care testing, which essentially means that we take rapid, miniaturized technology and we bring it close to the patient. And we have successfully done that in HIV and other infectious diseases like Ebola. Most recently, we've ventured out into partnerships that get us into specific types of cancer, sports-related head injury, and other mosquito-borne illnesses like malaria and dengue fever. And it's because this technology allows incredible sensitivity and specificity. It performs as well as a central laboratory.
Okay. And so now I was asking during the symposium, you still now have to go through clinical trials and have the FDA approve this technology. Do you have any idea of a time frame? Because I know this would be very important in diagnosing concussions.
Sure, I can talk a little bit about that. It's premature to talk about the time frame with the Food and Drug Administration, but what I can say is today we're in the process of assessing a number of different biomarkers to make sure that we put together a combination of biomarkers and this technology that can get us a level of detection that is required by the Food and Drug Administration. The discussions that we're having with them today have to do with what type of clinical trial would we have to initiate. Once we have an understanding of that clinical trial requirement, that'll help us understand the number of patients involved and the length of time that it will take.
Okay. And your company is located here on Long Island?
We are. We are in Medford, Long Island. We manufacture, we develop, and we also commercialize products that we sell in more than 43 countries around the world.
Okay. So explain now to how this evening.
So today, as we heard from a number of doctors as well as the panel, there is a certain standard of care that has evolved very well when it comes to sports-related concussion and traumatic head injury over the last 15 or 20 years, specifically as it relates to sports. What we intend to do is develop a rapid test that is an adjunct to the current standard of care and clinical diagnosis for traumatic head injury, including sports-related concussion.
And now this test may be something that emergency services personnel on an ambulance could possibly utilize, or it would be used in the emergency rooms. I'm just asking for some thought processes here.
Sure. So I think where the test is actually used, if we just talk about where an HIV test or other infectious disease tests are used for this same particular platform, they're used in clinics, they're used in doctor offices, and in some cases, HIV tests, like pregnancy tests, are used at home. What we would expect for a test to diagnose a sports-related head injury is that they would be tested under the care of a physician or a trainer for a particular team.
Okay. That's wonderful, and and this is the protein kinase, correct?
That's
right. Okay. And would this be done as a serial test, more than one? For my guess, if it would need to be 3, I mean, it might not be something that you know exactly right now, but probably more than one test.
So some of that will come from the clinical trial. We anticipate a yes/no version. You have a sports-related head injury or you don't. We also anticipate a more quantitative test that we would measure over a period of time, let's say over the period of a week. And in that case, we'd get a much more quantitative answer.
Okay. Well, that's wonderful. I'm glad to know that you're out there working on this, because it would be another adjunct to the diagnostic tests that are already out there, because this is a serious problem, and anything that we can have to help diagnose concussions sooner would be very beneficial.
We're certainly excited about it, and we're excited about the awareness around the issue as well.
Okay.
Thank you.
Well, thank you very much, John. It was a pleasure.
Thank you as well.
Okay. And this includes my evening at Adelphi University Alumni House for their symposium on sports concussions with John Spurzl. Thank you for watching, and have a safe and healthy evening.